What we are presenting this year is phase 2 clinical trial, like an interim analysis of the combination of ixazomib, Revlimid, and dexamethasone in high-risk smoldering multiple myeloma patients. This study I work on with Dr. Irene Gabriel, the principal investigator of the study. And it's part of the efforts of the Center for Prevention of Progression of Blood Cancers at Dana-Farber Cancer Institute. This is an interim analysis of 29 patients of the 57 patients that are accrued in the study. Basically the standard of care of smoldering myeloma patients is still to observe and just follow them up. However, there are patients who are at a high risk of progression to multiple myeloma, and multiple myeloma is still like an incurable blood cancer. So we try to the idea of early prevention, and if these patients will benefit from early intervention approach, either to prevent progression from happening, or maybe even if we can achieve cure in the future for them. In the 29 patients that we analyzed, the response rates actually were very high compared, in means of complete responses and very good partial responses of almost 55% of these patients. At the same time, this combination is oral, so it's not an infusion, so it's also very convenient for patients who are asymptomatic but still at a high risk of progression. They just come once a month, get their pills and have blood work to assess their response, but it's kind of very convenient for them. And in means of side effects and toxicity, most of side effects were grade 1 and 2, very few grade 3 and 4 side effects. We concluded that in this interim analysis of 29 patients, high response rates in means of complete response and very good partial response is very promising for this patient group who are at a high risk of progression. Also, the convenience of this regimen, it means that it's an oral regimen, is also very promising that we can expand more on larger studies in high-risk smoldering patients for the aim that we can prevent progression from happening or even achieve a cure in the future.